COVID-19 pandemic forced Matt to work from home.
Taking this opportunity, we investigated individuals' preferences for working from home based on profiles that we created from extroversion, conscientiousness, need for autonomy, and self-regulation.
We further explored these profiles based on job productivity and satisfaction through work engagement.
We found that employees of low social class who perceive social class to be highly central to their self-concept are more likely to experience workplace anxiety from COVID. This then facilitates emotional exhaustion and withdrawal behaviors.
We studied work patterns during stay-at-home orders. We found less temporal conflict than expected due to greater time fungibility and discretion. We found that workers are able to use time in a more substitutable manner where one day or hour of work time becomes replaceable with another.
My proposed study is on the role of enterprise social networks like Slack or Microsoft Teams in maintaining productivity during the pandemic. Do these tools facilitate employee entrainment to productive organizational rhythms during times of change? I look forward to your feedback.
Our research looked at empathetic leadership during COVID. We found that leaders with higher levels of empathy were more attentive to the crisis, made decisions faster, and their employees rated them with higher approval rates and better company outlook.
How can organizational leaders help their employees during a pandemic? This research investigates which well-intended leadership actions were helpful versus unhelpful during COVID-19.
When gyms and fitness centers in my state were closed by executive order due to the COVID-19 pandemic, I began teaching dance fitness classes online twice per week to help participants maintain and improve their health and well-being during the pandemic.
The virtual classes got my day started in a healthy way. The Zumba classes provided social interaction, a workout, and it helped to lower my stress level. We're excited that this effort to remain strong and healthy during the pandemic is being translated into an autoethnography.
Our team is excited to share with you our research on the implementation of telehealth and COVID-19 testing in opioid treatment organizations. Please join us.
Is increasing communication transparency good for creativity in remote collaboration? We find that it results in more empowered and engaged teams, but fewer novel ideas, pointing to a trade-off when designing remote teams.
In the context of COVID-19, whether working from home or not, we found that psychological capital, which includes hope, optimism, resilience, and self-efficacy, serves as a resource for helping individuals reduce stress by using more adaptive and less maladaptive coping styles.
Do you believe that some people just take better to remote work than others? We found that employees who believed that people either are naturally good at remote work or not tended to struggle more in the switch to home office during COVID-19.
In our study, we looked at the impact of working from home on employee well-being in Korea and the USA. We found that working from home was associated with less depletion through less overload. This indirect relationship was significant for liberals, but not conservatives in both countries.
COVID-19 is a fake news nightmare. Sharing of fake news has been associated with conservative political ideology, but we find that this is largely driven by low conscientiousness conservatives. Need for chaos emerges as the underlying mechanism, and worryingly, fact-checkers are inadequate to address this.
Hi everyone. In a multi-wave survey of 1,800 employees, we examined when employees feel fearful versus optimistic at work during COVID-19. Our main findings are that having a supervisor who adapts well or having high levels of self-efficacy play an important role in shaping whether someone feels fearful versus optimistic at work.
Our research shows that leaders who are undermined by followers feel a greater threat for their leader identity during the COVID-19 pandemic than before, but they do not retaliate more against the follower.
Greater perceived threat of COVID-19 was associated with greater anxiety and lower creativity. Collectivism can buffer the negative effects of perceived threat of COVID-19 on anxiety and creativity.
We found that in the context of COVID-19 remote working, for people who are more family-focused rather than work-focused, family-to-work enrichment decreases anxiety and enhances work effectiveness.
The purpose of my research is to better understand why and when employees effectively work from home during the COVID-19 pandemic and beyond.
What psychological resources help preventing work loneliness in this COVID-19 period? Which employees will bounce back from loneliness after this pandemic? We pursue these questions in a multi-level time-lapse study in a large municipality.
We discovered that after the shelter-in-place order, workers were able to rapidly adjust their workdays, although imperfectly, when they perceived the situation as temporary. Some of them were even able to project new meanings for their future workdays.
So you've heard of healthcare heroes, I'm sure, but we find healthcare workers are also being stigmatized during the pandemic. We explore how they manage the resulting ambivalence from that duality.
Our research shows that remote work and remote communication during the COVID-19 pandemic negatively affects well-being through self-control and self-regulation.
Caring for patients during the pandemic is extremely stressful and forces caregivers to drastically change the dimension of their work to ensure safety. How career shock can cause positive organizational behavior in senior health sector? What lesson can we learn for the future? What must be sustained because of the positive impact into everyday life?
745 instructional faculty at a 4-year public institution completed a survey in May 2020 to gather reactions to emergency virtual instruction. Some preliminary findings are on the slide.
The results of our study indicated that information exchange moderated the effect of cyberbullying on stress in remote workers. At the same time, we found that stress mediated the effect of cyberbullying on productivity.
Home-based work interruptions block the inverted U-shaped effect of challenge demands on work engagement for teleworkers during a lockdown period. High LMX could counteract this blockage.
Our research shows that states in the United States which adopted a more expansive policy approach to combat COVID-19 created more anxious citizens, but that these citizens cope with anxiety by greater job engagement, more trust in a leader, and greater helping behaviors.
During the pandemic, we find that informing people about the largely implicit process of emotional contagion, thus making it explicit and salient, lowers susceptibility to contagion and distress about the outbreak at 1 week, 2 weeks, and 1 month post-intervention.
For people who set more temporal boundaries for their work, higher perception of organizations' entrepreneurial orientation is inversely related to individual productivity. The relationship is positive, however, for people who set few temporal boundaries.
What minimizes negative emotional states such as stress and depression when returning to work after lockdown? Social support, induced by team interdependence. But timing is everything. Social support before lockdown is more effective than social support when returning to work.
Champions in the Time of COVID-19 builds upon an emergent theory of gender equality champions using case analysis to examine the COVID-19 response of prominent Chilean epidemiologist Jimena Aguilera.
This study explored how millennial employees made sense of transactional distance while working from home during COVID-19. We found that by utilizing specific properties of sense-making, millennials have established a new normal, a state of working which will require a nuanced change management strategy to undo.
My name is Jack John. I study how a sense of calling affects employees coping of furloughs under the impact of COVID-19.
There is a silver lining in this pandemic for organizations. Our study finds that the high emotional toll of job demands can in fact increase employee positive discretionary behaviors and attenuate deviance, and leader efforts in managing their employee negative emotions when combined with high trust can strengthen this tendency.